It's inevitable that we're going to see cases that involve sports leagues. Hopefully this is manageable. I know that the professional leagues have put into place really strong mitigation efforts, and they do have a lot of safeguards that we in the general public don't have, with how frequently they can test individuals and how much insight they have into each other's context. And this is sort of going to be the new normal until we have a vaccine.
Hey everyone, I'm Angelo Spaniolo with Bloomberg QuickTake.
And I'm Everett White. This is QuickTake's partnership with The Athletic.
Now, both the NBA and Major League Baseball are kicking off in the coming weeks. Major League Baseball is starting with a shortened 60-game season, and the NBA has been quarantining down in Orlando in the bubble for a few weeks now. Both leagues have different challenges for how they're going to get started, and both are taking on the threat of COVID-19 a little bit differently.
So to discuss those differences and the challenges of playing sports during a pandemic, we're joined by NBA senior writer Joe Vardon and Yankees beat writer Lindsey Adler from The Athletic, as well as Dr. Amesh Adalja, an infectious disease expert from Johns Hopkins University.
Totally. So Joe, Lindsey, Amesh, thank you for joining us. We really actually appreciate your time. We know everyone's super busy right now covering the sports as they reopen. So let's get right into it.
Yeah, let's jump right in. Dr. Adalja, you said in a report with the AP that certain sports have a higher risk versus a lower risk. What risk level do you put basketball and baseball at? And in your opinion, what sports rank the safest and most dangerous?
So I would say that basketball is one of the more risky sports because there's so much close contact, there's so much close proximity to each other. There's not any way to really social distance naturally when you're playing basketball. Baseball is a little less risky because there is some natural social distancing. People aren't really that crowded together except for during certain parts of the game when people are on base, for example, or at home plate batting. Dugouts can be socially distanced. So baseball is one that I rank as a lower risk. So I think the higher risk sports are things like basketball, football, wrestling, for example, if you're thinking about collegiate wrestling. And lower risks are things like golf, tennis, gymnastics, and soccer is also sort of in the middle there. So it really has to do with how much interaction there is between the players and how socially distant you can be during the game just naturally based on the rules of the game.
Yeah, I would say we've heard similar things about baseball so far. And that makes me think, Lindsey, what are you hearing from players and staff right now? What's top of mind? What's their top concern about safety as they get back on the field?
They seem to be okay with the protocols. Baseball, unlike basketball, is not doing a bubble situation. So there's a very extensive health and safety, operations manual. And so they are all wearing masks inside, but don't have to wear masks on the field. They can if they choose to do so, and a few players have done that. But mostly what we're hearing is just that they're, adapting to the new rules. The pitchers are trying to remember not to lick their hands. They're trying to remember not to throw the baseball around the horn, things like that. I think it's just, it's smaller things that everyone seems generally fine with. It's just kind of changes how they've done things for honestly their entire careers and their entire lives.
These teams that we've heard, both leagues, MLB and NBA, have robust testing in place. It's happening quickly. It's happening by the hundreds. How does that compare to the testing that's going on for regular folks in America who have to go to, an urgent care and wait in line?
It's a stark difference. It's nothing like instant testing. So if you are somebody that's an outpatient that needs to get tested, you may wait several hours to get your test, like we're hearing about in Arizona, and then your test result may not come back for 7 days or longer. It's really a useless test when it takes that long for turnaround. So this is a complete difference and a very stark contrast to what's happening with sports teams. When you're in the hospital, you can get a test result back pretty quickly, but it's this outpatient testing that really is a major bane for all of us in this field, and it's really hampering our ability to control this virus because it really makes contact tracing futile if it takes 7 or 8 days to get a test result back.
Yeah, well, I was going to say the question that I had, though, for the good doctor is obviously there's this perception that athletes getting their test results so quickly when so much of the country can't. It can be a bad look. But the question is, are these tests that are being done here in Orlando or what's going on with baseball, do the tests themselves actually impact the public's access to testing and results for testing?
It's unclear whether there's a direct impact. It's just a difference in how quick the turnaround time is and the prioritization that's going on with professional athletes versus patients that is causing this perception. I do think that if testing capacity is increased, and maybe because the sports leagues are paying so much money for those tests, that will incentivize companies to increase their capacity. So this can maybe have a trickle-down effect to patients who desperately need to be tested quickly. But I do think that this is going to be something that we struggle with, because clearly the major leagues are paying more money for those tests, and that's going to prioritize them in terms of supply and prioritize them in turnaround time. Hopefully this will translate into the general population as well. But in some leagues, for example, the NBA explicitly talks about this being a model for how we move society forward. And hopefully we'll see that occur over time.
And obviously the sort of movement is going to be different for NBA players versus MLB players. Joe, tipping to you, starting this week, NBA teams in the bubble are going to be able to freely go to each other's hotels, visit friends, talk to media a little bit more. What sort of risk do you see in that? And also, what went into the NBA's decisions in player, coach, staff, and media contact?
Well, it's living it. It's hard to see. It's hard to see the risks at least being great, because every morning when you wake up, you know that you don't have the virus. You've already got your negative test result, and so everybody that you are interacting with, you can be reasonably sure is healthy. And then on top of that, by and large, certainly in any of these public spaces where we are interacting, almost everybody has their mask on. Virtually everybody. I think where you can get sloppy is not so much that players will get to visit each other at different hotels. You're still not allowed in anybody's room. But it's just this idea that because you're playing games against these guys, you feel less like you have to wear a mask. And then in the meantime, somehow through a Disney employee or what have you, the virus sneaks its way in. I think that would be maybe one vulnerability that we haven't seen yet, but one that I would be on the lookout for.
And Lindsey, is there somewhat of a similar sort of fear, given that we're going to be going to different cities like you talked about?
I mean, it just sounds entirely different. You know, players are getting tested every other day, coaches are getting tested every other day, but like clubhouse attendants, other staff members are getting tested twice a week. Media, we are not getting tested through that. So it's really different from the NBA, and it kind of comes down to an honor system in terms of, you know, how safe everyone is being away from the field. And I think, you know, players are really going to have to self-police in that regard. And it's just, Do you
have a lot of faith in that self-policing, Lindsey?
I don't know.
A lot of the players will take care of. I've just heard NBA players, saying, yeah, the bubble is safer than how I've been living at home. And I wonder if you've heard anything similar from Major League Baseball players.
I've heard that, but also because it's not a bubble situation, there's so many different factors. It's even if player X is being super safe and, his wife came to New York to make it so that he doesn't have to go to the grocery store. Maybe she is the one who goes to the grocery store. Who knows what happens? She can be as safe as she, intends to be. And so it's just, you don't really have that like protective layer like the NBA, and there are just a lot more variables. And yeah, the testing is less frequent and the results are coming back with a bit of a longer delay.
Totally, yeah. So the onus is a little bit on you, rather than, whereas in the NBA, Joe, it seems like they let a really limited amount of reporters in and made you guys do that hardcore quarantine to avoid the kind of challenges that Lindsey's talking about right there.
Yeah, that's right. And I mean, we're talking about an absolute piece of history here, American professional sports history, one way or the other. Either they somehow navigate this and keep the virus out when certainly no one in the United States could do it. And it's just an amazing success story, or it crumbles and it's very bad with very long-term lasting financial damage to the NBA. And then in the meantime, it's a social experiment, putting all these very rich, very powerful athletes into this like very restricted community for a period of up to 3 months. So yeah, I mean, in a way, it's a very grueling assignment. In another way, it's an assignment of a lifetime. But I just, if I could say, I mean, whether we're talking about everybody at the ballpark or we're talking about being out in public, I mean, just living in this very unique community that I've been in now for however many days. It starts with the mask. Like the central tenet of NBA bubble life is the testing. Okay. But there's millions of dollars to throw around if need be for tests that not everybody has, but everybody does have access to a mask. And that's the thing, is that even though there is testing and there is constant monitoring and you aren't allowed to go anywhere outside of the bubble, everybody is still wearing masks as like an extra thing. And I think, the science tells us that these masks are supposed to work. And so if we're going to try this with baseball, and I hope it works, and football and everything else, like, you got to wear a mask whenever you can. And so for as positive as things are going health-wise, you still have to take it day by day and just hope that this all works out. And then the other thing that I know when talking to my colleagues who are here with me that we all share is, given the amount that we have to go through and we watch the players have to go through every day just to bring the season back, it's hard to imagine that in a couple months from now that there's going to be the start of another NBA season in arenas. And, I'm listening to Lindsey talk and thinking about her job and thinking about their players and just woefully inadequate testing compared to what is happening right now in the NBA. And I don't know how they're going to do it. I hope they prove us wrong and show that you can navigate a season in your own ballpark and flying across the country and come back to some sense of normalcy. But there is no normalcy here. It's very different. We're thrilled that we're going to be able to play basketball and hopefully crown a champion, but it's not normal, and it doesn't feel like normal is coming anytime soon.
Yeah, I would say, it's a big experiment in personal responsibility and what you as an individual owe to the people around you. It doesn't matter if you owe it to your teammates. It doesn't matter if I owe it to the people I interact with when I'm going to the grocery store. It's, what are you willing to sacrifice to aid in the, health and safety of your community? And I think a really good lesson here is, if a ball player can hit a home run wearing a mask, you can wear a mask going to the park, you can wear a mask going to the coffee shop, whatever. There are small, simple steps that you can take to try to protect yourself, but also protect others.
And you guys are great, so really appreciate it.
Thanks for having me.
Guys.
Thanks so much.